and welcome everyone again to ECD, the latest live. It is now my pleasure to turn the floor over to Katie Ham. Katie, the floor is yours.
Thank you so much, Glenna. Thank you everyone for joining us today. This is our second ECD Live where we invite parents, providers, Headstart staff, folks in states and communities all over the country to join us to hear the latest from the Biden-Harris administration on early childhood. I am delighted to have many colleagues here to talk with you all today. Thanks to everyone for filling out that poll at the beginning of our presentation. We know we have a lot of providers, parents, grantees here today with us, and we're thrilled to have such a diverse group of folks. We in particular have a lot of participants who've introduced themselves in the chat from Puerto Rico, so thank you to all of our friends in Puerto Rico for joining us today. Today we are going to talk about the summer. Summer is in full swing. We know that we have a lot of children who've had a most unusual school year. A lot of families are thinking about what does the summer look like for their families? What about summer camp? What about summer enrichment? How can we address some of the learning that we know children need as they prepare for the upcoming school year? And we also want to be working towards getting everybody back for in-person services in the fall. So we are going to talk today about summer learning, summer enrichment, and how we can all be preparing ourselves, our communities, our families for a fall school year with in-person services. And I'm really grateful to all of our special guests that we'll be having today to talk about that. You'll also have a chance to hear from several folks who are experts in this space, as well as a Headstart provider and a grandparent who are going to talk about their experiences and how they are thinking about this summer. Before we jump in, we want to invite everyone to go over to the chat box and put in a few words about what are your hopes for children this summer? What are you hoping that children get to do, see, feel this summer as we look towards the fall and get ready for what comes next? Oh, I see play, being with other children. I will say as a parent of a 5-year-old, I am really hoping he gets more time with friends. And I see I'm not the only one. Be with family and friends, socializing, out in the open, being in nature, making connections. Absolutely. Reconnecting with grandparents, smiles, normalcy. Pool and beach, me too. Thank you so much. I think we share a lot of the same goals. And part of getting to this place with children where they can be in their communities, be with other children, go to school, Headstart, childcare, is focusing on vaccines. And so earlier this month, the president made some important announcements around vaccines and a goal to get 70% of adults at least their first shot by July 4th. This is the most important thing we can do to protect children, is make sure that the adults around them get vaccinated. We at the Administration for Children and Families announced some guidance. States, tribes, and territories have $15 billion in COVID relief funds that they can use to support childcare providers who are caring for children while their family members get vaccines. So that's an important resource that you all can be using and asking your state leadership about, so that families that need to get those vaccinations don't have to worry about childcare while they go and get their shot and recover from any of the side effects. I am delighted to introduce a colleague from the White House COVID response team, Osarame Akola. She has been a great partner in our work on vaccines and making sure that the early childhood community has all the information they need to support this important goal. So I am delighted to introduce Osa, who's going to talk a little bit more about this initiative and the goal that the president has around the 4th of July. Osa?
Thanks so much, Katie. It's great to be here. So I think, just as Katie said, for our national vaccination campaign to really be successful, we need everyone to have access and to benefit from the phenomenal scientific discovery of our vaccines. And we can't beat this virus without making sure there's a plan that works for vaccination in all communities. That's why last week, President Biden announced a month of action to mobilize national organizations, local government leaders, community and faith-based partners, businesses, employers, social media influencers, celebrities, athletes, colleges, young people, and thousands of volunteers towards this effort. This is all towards an all of America sprint to meet our goal, just as Katie said, of getting at least 72% of the population with at least one shot by July 4th, and to advance equity so that more people can get the protection they need to be safe from a pandemic that has taken the lives of nearly 600,000 Americans. To ensure that we're reaching everyone who is unvaccinated in this phase of our vaccination program, we have to continue to, and we are continuing to, address structural barriers to access, focusing even harder on meeting people where they are, and continuing to provide the public with the answers they need about getting vaccinated. We have to make sure vaccination is both easy and convenient. So we've increased the number of pop-up and mobile units across the country. We've ensured that the majority of our 40,000 pharmacies participating in our federal pharmacy program are located in areas that are at high risk. And we understand that not everyone can operate on a 9-to-5 schedule, as many of you, all of you know. So pharmacies are now accepting walk-ins and have extended their hours. In fact, starting this week, thousands of pharmacies nationwide will actually stay open late every single Friday in June, get the word out, and offer services overnight throughout the night to make sure that individuals operating on a non-9-to-5 schedule can get their shot. And we've seen the difference that our pharmacy program has made to close the equity gap so far. Over the past 2 weeks, 50% of pharmacy doses have been administered to people of color, and we're really proud of that. Similarly, our community health center program, which many of you may be familiar with, that allows us to administer shots through federally qualified community health centers, remains another trustworthy and available option for neighborhoods across the country. And they're also closing on our equity gaps. About 70% of shots through the federal CHC program have been administered to people of color. Still, in conversations we've had with those that are unvaccinated, we often hear many of the same reasons for why they've yet to get their shot. Many have concerns about missing a day of work, traveling to a vaccination site without a reliable, affordable way to get there and back, or paying for childcare. For individuals and communities facing greater degrees of socioeconomic disadvantage, those who can't afford to miss a day or two of work, can't afford unexpected childcare or travel expenses, really risk a shockwave through a family's finances that just isn't tenable. So the COVID-19 response team, the White House COVID-19 response team, is focused on addressing each of these barriers: paid time off, transportation, and childcare. First, in April, the president announced a tax credit to fully reimburse employers with fewer than 500 employees that provide paid time off for vaccinations and side effects. And he called on every employer in the US to provide this paid time off. Second, many of you may know that Uber and Lyft are providing free rides to vaccination sites through July 4th. And just today, the Department of Transportation announced that more than 350 transit agencies across the country are also offering free rides to vaccination sites. We want to give everyone in the country as many free transit options as possible, by subway, by bus, by rideshare. And earlier today, during our White House COVID-19 press conference, Senior Advisor Dr. Marcela Nunez-Smith actually called on governors and local leaders across the country to ensure that your state, county, city, or town provides at least one free, accessible public transit and paratransit opportunity for your constituents during this month of action. And third, the focus of our conversation today, last week, the president announced that through July 4th, the nation's largest childcare providers will offer free childcare to parents and caregivers getting vaccinated and recuperating from vaccination. Because we're hopeful that all of you will work with us to get the word out or to participate, I want to run through the details of each commitment we announced last week, which are also available on vaccines.gov. Now, through July 4th, KinderCare is offering a free day of weekday care for children ages 6 weeks to 12 years old at their more than 1,600 participating centers nationwide. The organization is also offering free Saturday care in June at approximately 120 locations across the US. To sign up for free care, parents and guardians can call a hotline or visit kindercare.com/vaccine. Similarly, now through July 4th, Learning Care Group will provide families with a free day of childcare to get vaccinated and 2 days of free childcare if a parent needs to recover from side effects of vaccination, any side effects. Parents and guardians can call a hotline as well or visit learningcaregroup.com/vaccine to make arrangements for children ages 6 weeks to 12 years old at one of the company's 950 plus preschools across the nation. More than 500 YMCA locations in hard-hit and high-risk neighborhoods across the United States are also offering free drop-in childcare during vaccination appointments for parents or caregivers. Free care at these YMCAs is available 7 days per week from now through July 4th. And parents and caregivers are encouraged to contact their local YMCA to check availability. In addition to these commitments, Bright Horizons is providing free childcare for 10 million workers employed at participating organizations where they offer employer-based childcare, so that these workers can get their vaccination or recover from side effects. Parents or caregivers seeking vaccination can see if their employer is participating by calling a hotline or visiting the Bright Horizons website. And as many of you are probably well aware, and speaking with smaller community home-based providers, we also found that even though they were very eager to help, they didn't quite have the financial flexibility to offer free drop-in childcare to support vaccination. So just as Katie mentioned, last week, HHS ACF issued an FAQ that encourages states, many of you might know are on this call, to use child care funding from the American Rescue Plan to recruit community and home-based providers to support these efforts, to support the president's call to action, and ensure that child care is eliminated as a barrier to vaccination access in every community across the United States. We want to see child care eliminated as a barrier throughout this month of action, but to do so, we need your help. And we're asking for your help to call on states to use their ARP funding, or as a state leader, to implement ARP funding to encourage these smaller home-based childcare providers to join this effort. We're asking for your help in getting the word out about this availability, because it will only really be impactful if people know that it exists. And all of you, as early childhood providers and community leaders, are trusted messengers for many unvaccinated parents and caregivers. So we need you to also get the word out, frankly, about the importance of vaccination overall. As I said earlier, we cannot beat this virus without making sure that there's a plan that works for every single community to get vaccinated. And that means everyone, especially the parents and caregivers of young children who cannot yet be vaccinated, because these children need to be protected. And we've made incredible progress, and vaccination is now easier than ever. To find a local vaccine site, you can text your zip code to 438-829, and you'll be given the addresses of 3 vaccination sites closest to you, and also asked whether you're in need of childcare or transportation support during vaccination. The Biden-Harris administration is committed to addressing every equitable barrier to vaccination. And we're not going to leave anyone behind in our response. But again, in order to do so, we're asking for your help in getting the word out to our parents, our caregivers, and our families on the ground. So we're grateful for you being in this fight. We can do this. And I'm happy to answer any questions folks may have. Thanks.
Thank you so much, Osa. We really appreciate it. We had received a question ahead of time around ways we can support parents and families in getting the COVID-19 vaccine, and specifically around childcare and transportation. So the process is to ask the family to text this number that's in the chat, 438-829, and they will be connected not only with vaccine sites, but asked about their need for childcare and transportation and linked with some of those resources. So very much appreciate all of the work that you're doing on this. And we know that the early childhood community can be counted on to get the word out, to share with parents and their colleagues. So very much appreciate all of your efforts and your information today.
Of course, and Katie, I'll just kind of add one more thing. This is available to any child, so you don't have to enroll in any of these providers beforehand. They have a process of bringing the child on board. So this is available, especially kindergarten and learning care group. It's available to any single parent or caregiver across the nation, and the Y as well, YMCA. So I want to make that clear. I know there was a question in the chat.
Yes, thank you.
You're welcome. Thanks for having me.
Great. Well, as we think about vaccinations and all that we need to do to support children, we're working closely with the Department of Education to think about children from birth to 13 and all we need to do to support them and their families. So I am pleased to have with us today Miriam Calderon. Miriam is the Deputy Assistant Secretary for Early Learning at the Department of Education. She joined the administration last month. We're thrilled to have such a great partnership with the Department of Education that allows us to collaborate together, especially during this critical time when we're thinking about how we make sure children, regardless of what setting they're in, what program they're funded by, have access to the same high quality in-person services as we move forward. So Miriam, I'm going to turn it over to you to share more with the audience about what the Department of Education is doing in this space as we think about summer learning and the return to in-person services. Miriam?
Thank you so much, Katie. I am really excited to be here and to join you and my colleagues at ACF. As Katie said, I've been in this role for about a month. I'm coming from serving for several years as the Early Learning System Director for the state of Oregon. So I'm really excited to bring all that I've learned in the state, especially in this past 15 months. To be able to contribute those lessons learned to this administration's really bold agenda for early childhood, I think at a really critical moment for our field. So my role at the department, I just wanted to say a few words about that, is really to advance the administration and the department's goals for early learning, in particular focusing on birth through third grade. The department has programs, I think as many of you know, that span, that are critical for, I think, for our early childhood system, really spanning higher education, after school programming, equity focused investments that can support children beginning at birth. I'm thinking focused on our dual language learners, homeless children, children in the foster care system, children who attend high poverty schools. Of course, there are 1 million children across our nation that are served in our early intervention and early childhood special education programs that are administered at the department that are integrated into our early childhood systems in our schools across the country. And as Katie mentioned, our schools will play a very important role in a mixed delivery system of early care and education and in supporting continuity for children and families in kindergarten and the early grades. So it's really important that to advance this administration, the administration's early learning policy goals, that we work really closely with ACF and the important early childhood programs that are housed there to build more equitable early childhood systems in states and communities. So I'm very excited about opportunities to connect more with all of you as we build up this work at the department. So I wanted to say just a couple quick things around this topic and work that's happening at ED. One is that the Department of Education is supporting a summer learning and enrichment collaborative. So as part of the American Rescue Plan, there were investments, there was a set aside for schools, school districts for summer early learning and enrichment activities for this summer. So the department is supporting really a community of practice that is comprised of school districts, community-based organizations, and its state education agencies, where there is an exchange of best practices around program design and resources for programs this summer. I will put a link in the chat to the website so you can get more information about that, hopefully around some of this work that may be happening in your communities this summer. I also want to put in a plug for our early childhood IDEA programs. So our Child Find and early childhood IDEA programs are open this summer. They are up and running. We are encouraging referrals and partnership to expand child find activities, screening opportunities, assessments and evaluations are happening. And I think partners are definitely eager. I'm sure many of you are already connecting, but I think we're strongly encouraging more of those connections to happen so we can be connecting more children and families that need services to the services, including screening and referrals and evaluations. So thank you. I'm excited to be here. And with that, I will turn it back over to Katie.
Thank you so much, Miriam. I see in the chat that you are missed in Oregon, but we're really, really grateful that you are here partnering with us at the federal level and bringing all the experience that you have from Oregon and DC to bear in this context. I want to turn now to Dr. Ruth Friedman, who joined us as the director of the Office of Child Care a few weeks ago. Ruth is leading the Office of Child Care, which focuses on children from birth to 13, including after school and summer programming. And she's going to talk a little bit more about not only her leadership and what she'll be bringing into the office, but also what they are doing in partnership with their TA center to think about summer learning and summer programming in this most unusual summer that we're now into. So Ruth, I'm going to turn it over to you.
Thanks, Katie. Good afternoon, everyone. I'm so happy to be here with you today. As Katie mentioned, I'm actually just in my third week as the director of the Office of Child Care. I started my career as a researcher and therapist, focusing on resiliency in children and families. And then I took that background in child and adolescent development and families and moved it into public policy, and have now worked in ECE policy at the federal level for over 20 years. I spent most of that time working in Congress and leading the Democrats' early learning agenda in the House of Representatives, where I helped write federal laws on childcare, Headstart, pre-K, home visiting, and worked on child abuse prevention, family poverty, and juvenile justice issues as well. I'm really honored to have the privilege to lead the Office of Child Care at this moment, with the American Rescue Plan in front of us and the President's visionary ECE proposals in the American Family Plan. I know this has been a tough year on all fronts, both personal and professional, and certainly for the child care and ECE sector. I am truly hopeful that we are on the cusp of making a major change in this country on how we support families with young children. And I'm really looking forward to partnering with all of you to make that happen. It's going to be a collective effort. In the short term, the Office of Child Care will soon be releasing new guidance on the child care supplemental funds, the $15 billion that were part of the American Rescue Plan. And then we will be working with all of our partners to support a strong implementation. We think the funds that were part of the ARP are just so critical to getting more families the help they need, driving better wages for our child care workforce, and helping our child care providers get on stable and strong footing as we look ahead. I want to quickly conclude by acknowledging the important role that after-school programs played during the pandemic, providing emergency child care for essential workers, and the very unique role that they play in child care. Summer and after-school enrichment programs are so important to supporting families, which is why the Office of Child Care has specifically funded a TA center for this purpose for many years. And with that, I actually want to introduce Qatari Coleman, who is our project director at the Office of Child Care's National TA Center on after school and summer enrichment. And I'm going to turn it over to you, Qatari.
Thank you, Dr. Friedman. I am so thrilled to have the opportunity to share information about the National Center on After School and Summer Enrichment, better known as NCASE. NCASE is a training and technical assistance system funded by the Administration for Children and Families through the Child Care and Development Fund, CCDF. And our goal is to ensure that school-age children ages 5 to 13 in families of low income have increased access to after-school and summer learning experiences that contribute to children's overall development and academic achievement. Our primary audience are state, territory, and tribal child care and development fund lead agencies. However, our work is of utility to other audiences from state after-school networks to state education agencies, local education agencies, providers, families, and all. It's really important to note that before and after school, summer, and school breaks are times of care, education, and enrichment that can enhance a child's development and build family engagement. It is important to consider this unique space and time as children transition to school, like to kindergarten, and throughout the child's early childhood education experience and beyond. We know that after school and other out of school time coordination was and is critical with regards to school reopenings, and this is important in meeting the needs of family schedules. NCASE, through subject matter experts, facilitation specialists, provides training and technical assistance from national webinars to individualized lead agency technical assistance. And we develop and publish resources like research and practice briefs to elevate voices from the field. We have toolkits, tip sheets, and maintain a resource library with over 400 resources, and annually publish school age data profiles that provide Child Care and Development Fund data points for states and territories. Our 2021 profiles will be published next month. To give you an idea of our resources, our most recent publication, a Voices from the Field brief entitled How Partnerships and Innovation Support the Increased Need for School-Age Childcare During the COVID-19 Pandemic, spotlights the work of states like Vermont, Washington, and Nebraska's efforts to meet their school-age childcare needs. Next week, we are publishing a Voices from the Field brief on mental health that will be followed up with a webinar on the topic. And if you are an IPD, Individualized Professional Development user, via the Office of Headstart's Early Childhood Knowledge and Learning Center, we all know as ECLEC, the website there, you can access our online training module, Addressing Adverse Childhood Experiences in Out of School Time. This was developed in collaboration with the National Center on Early Childhood Development, Training, and Learning. It's important that I mention that we are so happy that we use a collaborative process with partners like the National Summer Learning Association and the National Institute on Idle School Time to address the issues of our audience, as well as input from a group of national out of school time leaders. Thus, summer learning and all things school age and out of school time are elevated through all of our activities and resources. Some links were placed in the chat so you can check out the resources. And I want to thank you for the opportunity to share this information about NCASE. And to learn more about us, please see our website link that is in the chat, I'm pretty sure. And if you have any questions, you can email us at ncase, N-C-A-S-E @ecetta.info. Again, thank you for this opportunity to share this information with you. And I think I'm turning it back over to Katie. Thank you.
Thank you so much, Qatari. That was very informative. In addition to thinking about summer learning programs, summer childcare programs, we are also thinking about our Head Start grantees who have been serving our families in communities around the country since the beginning of the pandemic. We know that returning to in-person services is especially important for the Head Start community. And I am pleased to turn it over to Dr. Bernadine Futrell, who's going to talk about the Head Start Forward campaign and some of the work that the Office of Head Start is doing to get us towards that fall in-person services goal and to make sure that children and families have what they need this summer. Dr. Futrell?
Thank you so much, Katie. And hello, everybody. It's so great to be with the community again. We had our first one last month where I introduced myself, and it's happy to see so many of you back. We're looking forward to doing this great work together. I am coming to share just a few updates around the American Rescue Plan as it relates to the Office of Head Start and the work that we have ahead of us. As Katie mentioned, we are so proud to have launched Head Start Forward, which is our national campaign to build back towards in-person comprehensive services together as a Head Start community. And so Head Start Forward is a recognition that we've all gone through something very significant, and even an acknowledgement that we don't know if we're in the middle, the beginning, the end of it. We know we've gone through something. And what we're saying to the Head Start community is, while we know the research and the evidence prioritizes getting back to in-person comprehensive services as soon as we can, including the fall programming, but we also know that it means doing it together. When the pandemic shut everything down, a light went off and we had to move fast. Now that the lights are kind of coming back on and there's light at the end of the tunnel, we have a great opportunity as the Head Start community to come together. So that's what we're doing. We're moving Head Start forward by prioritizing in-person comprehensive services and doing that together as a community. And so there are a few webinars that we are having. We had our first one on June 1st, and we have the next one coming up June 25th. You can go to eClick to get all of those dates and that information, or you can check the chat box out for information about the Head Start Forward initiative and moving us together towards in-person comprehensive services. Also within this, the Office of Head Start issued a program information. We issued two around the American Rescue Plan. The first highlights some of the uses of the ARP funding. We talked about that last month in this space, the ECD live webinar, but I want to also lift up that funding prioritized summer programming, the Head Start workforce, identifying what resources and support you could also offer families as we build back towards the pandemic, which brings me to lifting up our sleeves up for Head Start work. I know we just talked about the push towards July 4th. And so we are reminding and encouraging Head Start programs to think and use the creativity and the things that we've been doing so long to prioritize getting more families vaccinated as well. In addition to that, we are hoping and looking forward to hearing great stories about summer programming. We know there are quite a few programs who are doing summer programs, and we're very proud to have that. What I will say, this graph that's on the screen shows that we have a majority of programs are open, but what we're marching towards is in-person comprehensive services. So if you look at that green, that 34% on that graph, we're looking to move that one forward towards the 100% mark to get back to in-person. I know I only have 5 minutes here to share with you. There's a lot of information within everything that I'm saying. I would encourage you to join our Head Start Forward webinars that we are doing, where we spend time on every particular issue. The one on June 1st is on demand. You could go to the eClick website and watch that, where we really lift up strategies around enrollment, eligibility, recruitment, and selection for Head Start programs as we look to build back towards in-person comprehensive services. We have others coming up where we'll talk about key opportunities for us to use the ARP resources to really get back to in-person. That includes professional learning opportunities for staff, workforce priority when it comes to what it looks like when things are back in person. So I want to encourage you to just look at those resources on eClick and check out our video and our blog around the Head Start Forward campaign. Now, what I want to do is just kind of pause, because we're lifting up what we want and what we're expecting for the summer, and knowing that it's all building towards the fall. The vaccines, everything, it's building us back to in-person services. Well, we have a wonderful Head Start, two wonderful Head Start leaders they're going to share a story and talk with us about what they're planning to do with some of the ARP resources and how they're going to prioritize summer programming, fall programming. And so with that, it is my great honor to introduce Mr. Terry Day, who's a Head Start grantee. He's the executive director executive director of Families and Communities Rising, as well as their Head Start director. And I don't know, Mr. David, if I'm going to read this whole bio, but I do want to lift up that it says you're number 17 out of 18 children, and that you have a twin sister who's number 16. But what I do want to honor and lift up and say thank you for your leadership and your service is that you, in addition to being a Head Start director and doing your work, that you've also served in the United States Air Force as an intelligence specialist. So we thank you for your leadership and just your service to our nation and your continued work and partnership on behalf of children and families. And with that, Mr. David, I welcome you. Thank you.
Thank you, Dr. Futrell. I'm excited to be on and share some of the things that we're doing. But one thing I just wanted to add is I'm alumni for Head Start. You know, as you can see, I'm the 17th of 18 children and grew up in poverty. And I'm grateful for the opportunity today to be serving children and families who had a similar experience that I did growing up in Bennettsville, South Carolina. So thank you for that introduction. I'm really, really excited about the American Rescue Plan. It's going to enable us, as you stated, to get back to doing business and in person. And so we're going to be serving approximately 250 children. These are rising kindergartners, as well as we're prioritizing care for children who may have disabilities and need extra care. Some of them will also be 3-year-old students. We're really, really excited. We're using some of the funds to do some really creative things. And I think Head Start allows us to have some innovation and to do some. So we were able to hire also a clinical psychologist who's providing emotional and well-being support for not just families, but also for staff. So we're, try to, I guess, say, I like to say there's no box, right? So there's no box to get out of. We're just operating and trying to find the best ways. We're also using funding to increase our enrollment and recruitment activities in our state. And I also serve as the president for our Head Start Association. So I'm encouraging, all of our state here in North Carolina to do the same, encouraging them to support, the re-enrollment of children during the summer and to extend services to those needed families. One more thing I just wanted to say about our initiative, and that is we're able to support teachers as well who would normally not be working, Head Start teachers who wouldn't be working during the summer months. So I'm really excited about that. And we are trying to be creative to, again, serve our children and families and provide care in a way that's meaningful, and family supports as well in a way that's meaningful and will help families to move forward.
Thank you, Mr. David. And as a fellow Head Start baby alumni, I appreciate your leadership and I appreciate all that you're doing to really move families and communities ahead. Thank you. Thank you. The next story that we have is one that I know brought smiles to your face if you open the ECD Live newsletter. And that is a story of our grandparent caregiver, Mr. Randy Johnson. He lives in Newcastle, Delaware. He is the maternal grandfather to Noah. Noah calls him Pop Pop. And Noah attends Colonial Early Education Program, a Head Start grantee, and a 5-star quality rated preschool in Delaware. It also provides Part C early intervention programs. He takes Noah to school and cares for him after school while his daughter works. He is going to talk today about Noah's experience at his school and how important it has been to be in his life. He was also featured, as I mentioned, in our video for June for ECD, the latest live, and his grandson and daughter had a chance to meet then President-elect Biden when he visited their Head Start program. Please join me as we welcome Mr. Johnson. And as we get Mr. Johnson unmuted, I do hope you all will check out his video on our ECD Live webinar. in our newsletter. And if we can get him unmuted, maybe we can come back and hear his great story. Thank you. I'll turn it back to you. Oh, there. Hi. Hello, sir.
Hello, everyone, and thank you for having me this afternoon. Again, I'm Noah's grandfather, and this school year was quite an experience for Noah. In the fall, it started out being virtual because of the pandemic, and it was pretty interesting. At first, for a pre-K student as Noah, it was pretty hard for him to sit still and pay attention, and it gave me quite a bit of agita. But eventually, he came around, and I learned to just sit in the background and let him kind of follow along on his own. And once I got out of the way, he did very well. He did very well. And then once after the new year, when he attended the school, Noah has done exceptional. It's been a wonderful program. The teachers have been great. He's learning to share and be helpful and kind to everyone. It's just been a great experience for Noah. I look forward to him coming home and telling me about all the activities he's done and the friends he's played with, and I'm very proud of him.
Thank you so much, Mr. Johnson. You are doing life-changing work, and we appreciate it. And with that, we'll turn it back to Katie Ham. Thank you.
Thank you. Thank you.
Thank you so much to Dr. Futrell and Mr. Johnson. We know that many parents are also managing the same virtual school and the schedule with in-person returning. So we appreciate all you're doing, Mr. Johnson. I think one thing I was struck by in the video about your family is just how amazing that the teachers and the adults really were in supporting this little boy in his learning journey, whether it's virtual or in school. So we appreciate all that the early childhood community is doing, has done through this pandemic, and we know that you will be on the front lines as we march towards the fall and make sure that our communities are getting vaccinated and that our children feel supported and loved after all they have experienced over the last 15 months. Now I'm going to ask everybody to please take out your phone. So if you don't have your phone near you, take a minute to find it. And before we leave, I want to ask everybody, if you have not had a chance to get your vaccine shot yet, I want you to go ahead and text 438-829. You're going to text your zip code to that number. Again, text your zip code to 438-829. And that's going to give you information about the vaccine sites closest to you. And it's also going to ask you if you need childcare or you need transportation to support you. If you've already gotten your vaccine, I want you to go ahead and let 5 people know in your network who might not have had the opportunity yet. Text those 5 people and tell them, text their zip code to 438-829. Make sure they know that childcare is available, transportation is available, and offer to do what you can to support them. Share this with the parents in your programs, other folks in your network. We really need your help in getting the word out. With that, I want to thank you so much for joining our webinar today. It's been great connecting with everyone. We put this agenda together based on the questions that you submitted ahead of time. So we want to just thank you for taking the time out of your day, and we look forward to connecting with you next month. Thank you so much.
This concludes our event for today. Have a great day, everyone. Thanks for joining.
Thank you.